Good evening. The latest performance figures for accident and emergency units in England indicate that the pressure on the NHS continued into January, which turned out to be one of the worst months since records began. Many people suffered long waits on trolleys before being admitted to wards. 1,000 patients waited longer than 12 hours. The 4-hour waiting target was missed for the 30th month in a row, but over 85% of patients were seen within that time. That is slightly better than December, but the official target is 95%. Our health editor Hugh Pym has the latest details.
The NHS flat out, with staff working at a frantic pace just to keep services running. The system under severe strain, and patients are feeling it. This mobile team is trying to help reduce pressure on local hospitals.
OK, left here, then we're going to go right onto Cambridge Heath Road in about a kilometre.
Here, a senior A&E consultant is out on the road with a paramedic, literally taking hospital standard care to patients at home so they don't need to go to hospital. It's a partnership between London Air Ambulance, London Ambulance Service and Barts Health. They see an elderly man with dementia who's been in and out of hospital and ensure he's safe to be left at home with his carer.
So we carry with us a laptop which gives us direct access into exactly the same hospital system that we have. Yeah, we've got another job.
Every day they see the intense pressures on the NHS.
There's a lot of frustration. What we want is at the end of the day to be able to say we've done the best for our patients. And when the system makes that difficult, that can be very frustrating. And working in an overly congested system sometimes leaves us feeling that we simply can't deliver the best possible care for our patients.
Congestion was certainly clear in major hospitals from early in January, with overcrowding and trolleys in corridors and ambulances queuing outside hospitals, waiting to hand over their patients. This nurse in Leeds says even though thousands of routine operations were postponed to help the system, the pressure is intolerable.
I don't know whether it's sustainable what we do at the moment. It's wonder how long we can maintain this professionalism, this keenness and the caring attitude. It won't go, but it's just wondering, people will crack.
Some take the view that this winter's problems in hospitals are down to years of underfunding and not enough capacity to meet demand.
Over the last 7 or 8 years, we've cut the number of acute beds in our hospitals, which is now unfortunately sort of chickens coming home to roost, and we need to redress that balance as a matter of urgency.
It's all nice and smooth actually. Someone's looking after you well, aren't they?
Keeping people out of hospital is the aim of this scheme. Eliza is in a residential home.
How's your breathing feeling?
Her carers were concerned about her condition, but the team had enough time to carry out a range of checks to allow her to stay where she is. In the 3.5 months since it was relaunched as a 7-day-a-week service, more than 300 patients have been treated at home who otherwise would have needed ambulances to take them to A&E. Some of them would have otherwise been admitted to hospital, so beds have been freed up for others. It's just one local answer to the problem. The government says more money was invested in the budget, but the strain in the NHS this winter suggests there's no sign of any respite. Hugh Pym, BBC News.